Coming up on Family Health Today, we'll find out how members of the Northwest Arkansas medical community are fighting to ensure patients don't lose their rights to medical imaging services. Later, the very latest on U.S. plans to test the H1N1 vaccine. And they're back. How Harry and Louise could garner support for President Barack Obama's health care reform. Family Health Today is next.
Welcome to Family Health Today, Arkansas's only weekly in-depth look at the medical and health issues that affect you and your family. Brought to you by Jones Television, in cooperation with our sponsors, Northwest Arkansas Heart and Vascular Center and the Arkansas Democrat Gazette.
Hello, welcome to Family Health Today. I'm Dr. Janette Nesheiwat. A significant setback for President Obama's health care reform effort. He's been pushing the Senate for quick action, but many senators have pushed back. And now, Democratic leader Harry Reid has put off a vote until after the August recess. Dana Bash has more.
The writing was already on the wall, but this made it official. The Senate will miss the president's deadline for a health care vote by next month.
I think that it's better to have a product that is one that's based on quality and thoughtfulness rather than trying to jam something through.
Why the delay? A big reason is disagreement among the president's fellow Democrats. In fact, inside this room, just before that announcement, Democrats trying to hash out health care legislation had what sources described to CNN as a lively and contentious meeting. Democrats voicing objections and differing opinions to many aspects of what bipartisan negotiators have been working on.
It was the most honest discussion of agreements and disagreements that I've been a part of in the last 3 months.
It gave me a very good opportunity to learn from senators on the committee, what they want, what they don't want, what their real concerns are.
Concern and Democratic disagreement continues to delay a House vote as well. House Democratic leaders had their own testy meeting in this room.
It might be one of the most contentious.
The Democratic divide here. Conservative Democrats want to slow down, saying their party's plan spends and taxes too much without sufficiently cutting medical costs. Liberal Democrats, including members of the Black Caucus, disagree.
We're concerned about the efforts to delay and frustrate this process.
But unlike the Senate, for now, House leaders appear determined to pass a bill by August recess.
We leave here without doing this. Nobody is going to interpret our going home as listening to people. All of you all will report that we went home to take a vacation in August without having done it. That's the headline.
Behind those closed doors, 6 Senate negotiators are working to make another headline, a bipartisan deal on health care reform. But it's still unclear if that can even happen before Congress leaves for summer recess. And the senators in that room insist they won't be rushed. Dana Bash, CNN, Capitol Hill.
President Obama is not letting up on his efforts to gain support for his plan to reform health care. The issue is as crucial as it is complex. So what would the president's plan mean for you? Brianna Keller breaks it down.
Here's what Democrats say their insurance overhaul would do for you. Insurance companies could not deny you coverage for a pre-existing condition, and you would be required to purchase health insurance or pay a fine. Can't afford insurance? The government would chip in, and in most cases, so would your employer. So how much would you pay? House Democrats say they will cap your health care costs.
There will be an annual limit on out-of-pocket expenses and no lifetime limits on care. There will be no more co-pays or deductibles for preventive care that can catch devastating illnesses in time.
If you don't get insurance through your employer, some in Congress want to change how you buy it on the individual market by creating a central clearinghouse. It's also called a gateway or an exchange where you could buy insurance after comparing different plans. Many Democrats in the House and Senate want a government-run insurance plan included among those options, insisting private insurers won't lower their prices without the competition. But Republicans say it will drive private insurers out of business.
Your health care. You have a very good risk of losing your health care and ending up, if you're poor, your only option is a failed government program that none of us would join if we could possibly avoid it.
But Democrats and President Obama say if you like the private coverage you have now, you can keep it.
If anyone says otherwise, they are either trying to mislead you or don't have their facts straight.
The race is on. That's how the government is describing its efforts to find an effective swine flu vaccine before a possible autumn resurgence of the H1N1 virus. Both Congress and the Food and Drug Administration held meetings on the H1N1 last week. And the National Institute of Allergy and Infectious Diseases is set to begin testing potential vaccines at its network of medical facilities around the country in the next few weeks. Trials will soon be underway in 8 cities, including St. Louis and Houston. The initial studies will try to determine which vaccine works best and what the optimal dosage is. Potential vaccines will first be tested on healthy adults and senior citizens. If a vaccine proves safe, researchers will begin trials in healthy children ages 6 months to 17 years of age. Once the FDA approves a vaccine, the CDC Vaccine Advisory Committee will decide who should get it first. One of those U.S. cities testing the vaccine is Cincinnati. Cincinnati Children's Hospital Medical Center is testing 2 experimental vaccines. Michelle Hopkins reports.
As one of 8 hospitals testing the experimental vaccine at Children's Hospital in Cincinnati, they know the pressure is on.
We're reporting everything that happens as quickly as we can.
And they're looking for volunteers. As many as 20 a day will be enrolled, and researchers are looking for children as young as 6 months and healthy young adults. Health officials say an H1N1 vaccine could be available by mid-October.
A large focus will be on schools because we expect them to be among the first to get vaccinated.
School-age kids are at the top of the list, as well as pregnant women. County health officials say you should have your own plan, too.
If we're talking about one of the target groups being school-age children, that individuals should sort of think through in those plans what they might do if their child gets sick. What would they do with daycare?
For now, the focus of the battle against H1N1 is on the vaccine itself. At Cincinnati Children's, they're working on making sure whatever goes out is safe and effective.
There will be some children here that are protected before anyone else.
China has put in place some of the toughest procedures in the world to deal with H1N1. So far in China, there have been just over 1,500 cases, and so far, no reported deaths on the mainland. 63 high school students and 7 teachers from Medford, Oregon, were confined to this Beijing hotel for the past week after testing positive for swine flu. They spent their days in a negative pressure isolation room like this one, surrounded by doctors and nurses in protective clothing. The students got to eventually leave the hospital and will now continue on with their cultural exchange program. Well, a couple of weeks ago, we told you about some smokers in Ohio who were getting around their state's smoking ban in public places with electronic cigarettes. Well, since then, the Food, U.S. and Drug Administration has announced the cigarettes contain carcinogens and toxic chemicals such as diethylene glycol, an ingredient used in antifreeze. Electronic cigarettes, also called e-cigarettes, are battery-operated devices that generally contain cartridges filled with nicotine, flavor, and other chemicals. The electronic cigarettes turn nicotine and other chemicals into a vapor that is inhaled by the user. The products are marketed and sold to young people and are readily available online and in shopping malls. These products do not contain any health warnings comparable to the FDA-approved nicotine replacement products or conventional cigarettes. Public health experts fear electronic cigarettes could increase nicotine addiction and tobacco use in young people. The government says she's dead, but Sheila Lucas in California is not dead, and she says the mistake has created a medical nightmare that could cost her life. Erin Briscoe reports.
Sheila Lucas has been locked away in her apartment living in fear she may run out of the medicines she depends on.
Really important ones I'm going to be out of completely.
By next week?
Yeah. By next Monday or Tuesday, yeah. And then they're gonna probably come in and take all my equipment, my breathing equipment, my oxygen tank. I have to have at bedtime.
Lucas's Medicare, Social Security, and in-home services has all been cut off after Medicare declared her dead.
The Medicare has reported to them of my death, and my coverage has been canceled. They're offering their condolences to my family.
Lucas, who is wheelchair-bound, has been spending the past few days making phone calls, trying to figure out how this could happen.
They ask them where it comes from and who did it. They won't tell me anything. All they'll do is give me my death notice the day I died, June the 23rd.
And nearly 1 month later, Lucas was notified of her supposed death. Now she's afraid by the time this gets figured out, it will be too late.
Oh, it'll get taken care of. Just give it time. It should be 5 days. Oh, one lady told me maybe 30 days. So, well, I'm not going to be here in 30 days if I ain't got no medicine. I will be dead.
Well, a congressman was contacted about Lucas's situation. Lucas says she's been told she'll get the Social Security check and the pharmacy will make sure she has her medicine while the situation is figured out. Up next on Family Health Today, some members of Northwest Arkansas's medical community are stepping up to make sure patients don't lose access to medical imaging. After the break, we'll explain here on Jones Television Channel 22.
Getting fit, eating right, and staying up on the latest health news. They're good habits that can help you look and feel your best. You can get the details on the top health and medical stories every week in the Arkansas Democrat-Gazette, the state's largest newspaper. Take a more hands-on approach to good health and pick up some good habits, like the Arkansas Democrat-Gazette.
Here in Northwest Arkansas and around the country, access to medical imaging services is being threatened by proposed reimbursement cuts as a way to help offset the Obama administration's $1 trillion health care overhaul. Under the proposed plan, medical facilities that offer x-rays, sonograms, and MRIs will be significantly underpaid for their services if they don't increase utilization of their equipment from 50 to 95%. Diagnostic imaging services are crucial in detecting diseases like breast cancer. To take a closer look, we are joined by Allison Levin, Executive Director of the Susan G. Komen for the Cure Ozark affiliate, and Dr. Stephen Harms, a nationally recognized specialist in breast MRI with the Breast Center of Northwest Arkansas. Welcome to the show. Thank you. Thanks for being here. How are these medical imaging services used, and what's their benefit, Dr. Harms?
Well, most people in this country are now diagnosed using medical imaging. When's the last time you heard of somebody getting operated on to get a cancer diagnosed or to find anything? Most of the time when the patient goes to the emergency room or goes to see a doctor, the next step is get an imaging examination to find out what's going on. These are the studies that provide us with the diagnostic information to better treat patients.
Are they cost effective?
Many, very cost effective. If you think about the cost of doing unnecessary surgery or doing diagnostic surgery compared with making an image to make the diagnosis, it's much cheaper to do an imaging procedure. If you look at it from the patient standpoint, it's a lot easier to recover from an imaging procedure since it doesn't involve usually time out of work or recovery like it would with surgery.
Right. How expensive are they?
Well, it depends on what you get. And of course, they're staged at different levels. Things like screening mammograms are relatively inexpensive. If you go on up to MRI or other procedures, then they can get very expensive. That's why you need to work up the food chain before you finally get to the more expensive tests.
Right. Allison, we know mammograms, ultrasounds, MRIs of the breast, they're so desperately needed because they save lives. How are they saving lives?
Well, I brought a little prop to show, and what I'd like to say is that, this is just to show you sizes of potential tumors, but the smallest size here would be if you had a mammogram and you could compare this tumor to another slide, and that's how small that a mammogram can pick up a breast cancer. The next size is obviously a little bit larger, that's doing breast self-examinations, that you could pick something up that's that small. And as you go up, you can see it gets bigger and bigger.
Wow.
As they get bigger, and if they're not diagnosed, they take longer to treat, and they're probably obviously more invasive.
Pretty significant size changes as well.
Very significant size changes.
Dr. Harms, what are our current utilization rates of imaging services here in Northwest Arkansas, and how do we compare as a whole to the country on average?
Well, in general, in Northwest Arkansas, in the state of Arkansas, utilization for MRI and CT services averages about 45%. So obviously there's a big gap between this 45% and the 95% proposed by the Obama administration.
So do you think it'll be difficult to have to get those rates up and increase them?
Well, there's going to be some problems associated with these changes in rates. Obviously, you're not going to be able to pay for a lot of machines based upon that lower utilization when you're figuring your reimbursement based upon a 95% utilization. So some places are going to close, and the ones that remain open are going to be a lot busier.
Do you have any ideas of how we can increase those utilization rates, and what exactly will happen besides closing if we can't get them up, if we can't get those numbers up? Allison?
Well, the problem with increasing utilization rates means that breast centers are going to have to stay open longer to be able to service as many patients that are that would be in need. And what you're talking about is increasing utilization but decreasing the reimbursement.
Yeah.
So if you do the math, it just won't be profitable.
What does this mean for patients?
It means waiting longer to have medical imaging performed. And also in some of the rural communities where people rely on the hospitals there, many of those smaller hospitals might not be able to afford to stay in business.
Wow.
So it puts a huge burden.
How does this affect doctors, Dr. Harms?
Well, there are a lot of times when we see a patient, we don't know that this patient's going to have an illness when we see them. We know that people come in all the time that are either asymptomatic or didn't know about their disease. You find a cancer, you're going to want to get that treated fairly quickly. Well, if we're booked up at 95% capacity, then we won't have access to the machine. The patient will have to wait. Things could happen in between that time period that they're waiting on the machine. I think the problem is that they're anticipating that this is a factory you'd like to run at 95% capacity, and maintain that a lot of factories in the United States probably don't run at 95% capacity. But if you're running at 95% capacity, then you have no ability to accept patients that are emergent patients with recently diagnosed cancers, things like that. It becomes very difficult to get services quickly when you need them.
I see. Now, you both were involved in a press conference recently in Fayetteville. Tell us about that. What was the purpose of it?
Well, the purpose was to bring awareness to what's going on. And in order to do that, we're running some footage right here. It's called Right Scan, Right Time, and the purpose was to educate the public as to what some of these proposed changes are in our education or in our healthcare policies. And we talked about if these utilization rates were to increase, what it would actually do to patient care. And if you think about what the breast center does, you may go there for a regular mammogram, but in doing your mammogram, they find something. They have the opportunity right then and there to schedule you for an ultrasound, or actually take it a step further, actually do a diagnostic next and then do an ultrasound. So if the utilization rates go up to 95%, there's not going to be that opportunity to provide customer service.
Now, you actually went to Washington, D.C. as an expert and discussed this. Tell us about that experience.
Well, my role was really to talk about what it would do to the rural community. And when you look at some of our rural partners, there's so many other barriers to access to care, such as lack of transportation, lack of income, lack of motivation, or just being scared, that if you add this additional burden and barrier to getting access to care, they're out of luck.
I see. Dr. Harms, do you think if this change does occur, that, for example, women starting at age 40 and up, they are told to have a mammogram yearly, screening mammogram, do you think that'll change to every 3 years or every 5 years, or do you think it'll still stay at every year or every other year?
Well, unfortunately, fortunately, the government doesn't control those guidelines. That's the American Cancer Society, which is based upon evidence. And that evidence is not likely to change. Although in some countries where there is cost constraint pressures, like in Britain, they only do a mammogram every other year. And then in Canada, they only start mammograms at age 50. So, and of course, the size of the cancer detected in Britain is much larger. It costs a lot more money to treat those cancers, and their survival is not as good. So the highest quality detection is what we have here in the United States, which are based on American Cancer Society guidelines.
When is the final vote? When is the decision going to be made? Do we know?
Well, I heard today that it will not happen before they recess for August. So your guess is probably as good as ours. I think that President Obama would like to get it done as soon as possible.
Okay. If our viewers want to go and get some more information, where can they go? Is there a website available for more information?
Well, there's a couple of websites. Right Scan, Right Time would be a good resource as well. I think they just need to write their congressional leaders or to call their congressional leaders and become educated on what's happening.
Absolutely. Any final thoughts?
Well, I think let's imagine what it would be like as a consumer if our grocery stores ran at 95% capacity, and we had, because they're running at 95% capacity, we have fewer stores because the one store we've got is a lot busier. And imagine what the customer service is going to be like in this store if they have no competition and if they don't have to decrease prices or compete on the basis of service with other grocery stores. That's what we're facing in medical care.
That's a very good analogy. Well, thank you both so much for being here with us today. We appreciate your time and your expertise on this topic.
Thank you.
Thank you.
All right. Coming up on Family Health Today, a look at how two actors could influence public perception of President Obama's healthcare reform.
Award-winning Jones Television, Northwest Arkansas's 24-hour nonprofit cablecast, is now on the internet. JonesTV.org features a first-hand look at what the station is doing for the organizations and people of your community. The site gives you access to the daily TV schedule, as well as various clips of shows hosted by local experts. And our community calendar gives local organizations the opportunity to promote upcoming events in Northwest Arkansas. Jones Television, Channel 22, bringing you timely community programming, public service announcements that benefit our nonprofit partners, and now an easier way to learn more about us. www.jonestv.org.
Welcome back. Ever woken up to find redness and swelling on a part of your body and wondered what it was from? It could be the results of an insect sting or bite. We get more on this medical condition from the pharmacy.
Signs and symptoms of an insect bite result from the injection of a venom or other substances into your skin. The venom triggers an allergic reaction. The severity of your reaction depends on your sensitivity to the insect venom or substance. Most reactions to insect bites are mild, causing little more than annoying itching or stinging sensation and mild swelling that disappear within a day or so. Applying ice and taking an antihistamine pill will help. Only a small percentage of people develop severe reactions. Severe reactions may progress rapidly. Dial 911 or call for emergency medical assistance if the following signs or symptoms occur: difficulty in breathing, swelling of the lips or throat, dizziness, hives, vomiting, or cramps. From the pharmacy, I'm Carl Collier.
Back in 1994, the health insurance industry helped derail President Clinton's plan for health care reform with the Harry and Louise ads. Now, as President Obama pushes his plans for reform, Harry and Louise are back. And as Jim Acosta reports, the two actors have changed their story.
President Obama is urging Americans to tune out the forces against health care reform.
I know that there are those in this town who openly declare their intention to block reform. It's a familiar Washington script that we've seen many times before.
Oh, the paper says Congress is moving ahead.
But one part of that script has changed, as in the pages marked Harry and Louise. In 1994, the fictional couple appeared in TV ads sponsored by the insurance industry, famously opposing President Clinton's plan for health care reform.
If they choose, we lose.
Flash forward 15 years.
Well, it looks like we may finally get health care reform.
It's about time.
Harry and Louise are back, this time in favor of Democratic proposals to overhaul the system, turning the kitchen table on the issue.
A little more cooperation, a little less politics, and we can get the job done this time.
So you got the old band back together.
We got the old band back together.
But they're singing a different tune this time.
It's different lyrics. The lyrics now make it clear that it's very important for our nation to actually get health care reform and to get it this year.
Health care reform advocate Ron Pollock with the group Families USA brought the actors back to the studio, hoping for some Harry and Louise magic of his own. In a behind-the-scenes look at the making of one spot, the actor playing Harry, whose real name is Harry Johnson, gives his own take on health care.
And hardly anyone can afford to have health care anymore. People are losing health care every day.
The original Harry and Louise spots were so powerful they were spoofed by the Clintons themselves.
It says that eventually we are all going to die.
Under the Clinton health plan? I've never been so frightened in all my life.
And the actors just got a pat on the back from Republican Party Chairman Michael Steele, who appeared unaware of the couple's recent role reversal.
Harry and Louise helped save us from Hillary Clinton's health care experiments in 1994. This year, Harry and Louise have been replaced by another couple, Harry Reid and Nancy Pelosi.
But nowhere in the new Harry and Louise spot is there a mention of the Democratic proposal to give Americans the option of joining a government-run health care plan, the so-called public option. That's because a co-sponsor of the new Harry and Louise ad, the pharmaceutical lobby, Pharma, says through a spokesperson it's too early to tell whether it will support the public option. Jim Acosta, CNN, Washington.
Thanks for being with us for Arkansas's only weekly medical report. If you have any health news or story ideas that you'd like to see on our program, we'd like to hear from you. Visit our website, jonestv.org, and drop us a line. Join us next time here on Jones Television, Channel 22. I'm Dr. Janette Nesheiwat.
I am an American soldier.
I live the Army values.
I will never accept defeat.
I am disciplined, physically and mentally tough. I am the guardian of freedom
and the American way of life.
I am the Army National Guard.
Defend freedom. Visit 1-800-GO-GUARD.com today.